We're gonna get our scissors. I got my t-shirt. I kind of made a mess of it before, but so let me just straighten this out. You're just gonna cut off a rectangle, the size of your face. So since you guys are mostly kids, you want it to be about 6 inches, which I have my trusty ruler here. So go here and then cut here, okay? So at the edge, and you're gonna make a rectangle. So I'm just gonna cut straight across. And because I'm using a big t-shirt, this is gonna make 2 different masks. So I'm gonna just cut over here. And really you only want about 16 inches across. You don't need much more than that. So for me, that's about right here, just because I like to make things a little bit neat. And then I gotta cut on this side over here, because you just want one big long rectangle. And so that's what I have right now, right? One big long rectangle. That's about 6 inches by 16 inches wide, okay? Then you're gonna wanna cut off 2 strips. What I did, right, on the extra material that you have here. You cut off a strip about an inch wide. And if you're using cotton, here's the neat thing about cotton. Do you see this flat thing? If you pull it, it turns into thread, right? You can just keep stretching it and stretching it, not too hard or you break it, like just like I did, but you can stretch it and it makes it a lot longer for you, okay? So that's what I did. I had these 2 pieces. I'll undo this so you can see where. And you're gonna lay one a few inches in over here, and you're gonna lay another one a few inches in on the other side, and then you're gonna flip that side over like this, and you're gonna flip that side over like this, and that's it. You've made the first part of your mask, okay? Then you wanna tie the top right up here, tie it in a knot, because that's the thing that's gonna go over your head, and it's gonna make it easier for you to put on. So do you see that? I tied that knot at the top there, okay? Now here's where you can do some other things that we had talked about, and of course I can't find it, but this right here at the top is where you can put the thing that you want to do over your bridge of your nose, and you can fold that over and glue it down if you want, okay? You can also sew this together or glue this together to make it easier to put on your face so it doesn't fall off. And this is where you would slip in down here your paper towels or your coffee filters or your Kleenex or whatever else you want to use as a filter. But you don't have to do any of that. This right here is the mask. All the other stuff is extra if you want to help make it better for you and easier. Because right now when you lift this up, you got to kind of hold things together, otherwise it'll fall apart, all right? But this works perfectly. So then I'll show you again how you put it on. So you hold it. This part that you tied goes around your head. You kind of have to hold it right here with one hand, and the strings on the bottom, you're gonna pull. And you see how it tightens up your mask? Pull. Do the same thing on the other side. Pull. Tightens up your mask. You want to make sure that your mask goes up here. So you may have to adjust it a little bit. Goes over your ears and goes underneath your chin. And then you just tie it on the back. Or you have someone else tie it for you if you're not very good at tying it. And there you made it. Great job, guys. COVID-19 is the name for the specific virus that is happening right now. We have coronaviruses that people get sick with every year. Coronavirus is a category of viruses. COVID-19 is more of the specific term for it. So like paper tissue that you blow your nose with is tissue paper, but we usually call it Kleenex, right? But Kleenex is a type of tissue paper, and tissue paper is a broader category. So that's kind of the same thing, is that coronavirus is this big category of different viruses, and COVID-19 is the one that we're dealing with right now. And so how you know if you have COVID-19, mostly you get a cough, or you have some difficulty breathing, or you feel like it's hard to breathe. You can also get a fever, chills, which is kind of feeling cold and a little bit jittery and shaky. You can have pain in your muscles. You can get a headache. Your throat can hurt. And a really interesting thing with it is you lose the ability to smell things and taste things, only temporarily while you have the virus, but that's kind of an interesting thing with it. We think it goes from person to person, and it's spread through saliva or snot, right? You sneeze and your snot droplets go everywhere, and that's the virus hiding in that. There's a lot of information going around. Some of it is true and some of it is not true. So we wanted to go through some things that you may have heard and you didn't know if it was true or not. So let's hear some things. So there's no evidence that pets can spread COVID-19 to humans. Got a couple of fictions, couple of facts.
All right, let's reveal what the answer is.
That's true. So remember we talked about that coronaviruses are part of a large family of viruses. Well, they're very common in people, and actually they are common in animals too. So we know that camels, kettles, cats, and bats all can get coronaviruses. And we think that this COVID-19 actually originated in bats, but it's not proven. We don't know for sure if that's just a theory that we think that. So right now, there's no evidence that the pets can give it to you, but there is evidence that we can actually give it to our pets. So there has been a small number of pets that have been infected with COVID-19, but it's because of us. Drinking water protects against COVID-19. Fact or fiction? It's fiction. So drinking water is always a good idea when you don't feel good, right? Especially if you're running a fever. You do need water because you'll get dehydrated. But there's no evidence that drinking more water will help keep you from getting COVID-19. It just, you want to drink water to be healthy normally, but it doesn't have any extra protective value. All right, question number 3. Fact or fiction? Warmer weather will make coronavirus go away. So that's fiction as of right now, right? So we don't know whether weather or temperature is actually going to affect the spread of COVID-19. We do know that people around the world in different climates are getting COVID-19. There are some other viruses, so like the cold and the flu do spread better during colder weather months. That's why we see it in the winter time around here. But it's still possible to become sick with these viruses during other months. And again, we are seeing COVID-19 in warmer climates. Question number 4. Fact or fiction? A sneeze can travel as far as 26 feet. That's a fact. In many studies, it has been found to go that far. When you sneeze, you can really get your snot really going across the room. And it actually can stay suspended in the air for up to 10 minutes. That's why wearing a mask is so important, because, or sneezing into your elbow, right, is that it's hoping to keep some of that droplets not from flying so far and getting onto things. Question number 5, fact or fiction? You should stand at least 6 feet away to safely social distance. Fact, that is true, right? So we know that it spreads through, again, respiratory droplets. That's the big word that we're using, right? But it's more likely that when you're in close contact with someone, that's when you're going to get it. So you do not want to gather in large groups. You need to stay at least 6 feet away and wear a mask. Question 6, fact or fiction? Coronavirus is detectable on cardboard for 24 hours and 2 to 3 days on plastic. We got a lot of facts. A lot of people are saying fact. And the answer is fact. That is true. So they've studied it on actually a lot of different surfaces, but it's not just being on the surface, right? You have to touch the surface, pick up the virus, and then touch your mouth or touch your nose or touch your eyes, and that's how the virus gets in. So it doesn't go in through your skin. It's got to go in through what we call mucous membranes, right? Wet things. So your nose is wet, your mouth is wet, your eyes are wet. That's how it gets into the body. Question 7, fact or fiction? You could have 0 symptoms and still have COVID-19. That means you could be feeling totally fine and you can still have the virus. Is that true or false? Fact or fiction? And the answer is fact. So the fancy term for that, which you may hear on the news, is called asymptomatic carriers. That's the big medical term. But what that means is you feel fine. You feel totally normal. But yes, you can still spread the virus if you have it. So that's what makes it so tough. Question 8, fact or fiction? Touching your face is one way you could spread germs that cause the COVID-19. Fact. I think I gave you the answer, right? The answer is fact, right? That's what we talked about in the previous slide. So that's why you want to avoid touching your eyes and nose and mouth with unwashed hands. Make sure to wash your hands with soap, and you want to do it for at least 20 seconds. So you can sing whatever song you would like in your head, but make sure that you do that for 20 seconds or so. Question 9, fact or fiction? Using suntan lotion will prevent me from getting COVID-19. What does everybody think? That's a fiction. No one believes this one. All right, the answer is fiction, right? Suntan lotion will help prevent you from getting a sunburn, but it does nothing to help prevent you from getting the virus. The way that you can help do that is washing your hands with soap and water. You can also use the alcohol-based hand sanitizers. You have those. Wear a mask that we just learned how to make. And you want to make sure that you clean objects in your house that you touch. So like door handles, everybody kind of touches those, and sometimes they don't wash their hands, or the knob that flushes your toilet. You got to clean that off, right? Question 10, fact or fiction? There is a vaccine available now for COVID-19. Vaccines are shots that help prevent you from getting certain illnesses. Got a couple of fictions, got a couple wishes, and the answer is fiction. We have a lot of studies going on right now, but we do not have a vaccine yet. It takes a long time to get a vaccine out because it's really hard to make the right one for it to help prevent you from getting that infection. So they're working on it, and they're working on it really hard, but usually it takes a year to year and a half before vaccines are available for new things.
All right, thank you, Dr. McBrine. So students, we're going to show you a quick video of someone else who is doing something similar with helping during this time. This is Amanda, who's making gowns for nurses in New York. So we'll play this, and then we are going to have some questions.
Hi everyone at Citizen Schools. My name is Amanda Davis, and I'm coming to you from New York City, or what is New York City to me these days, which is my apartment. I've been sewing for about 10 years now, and I wanted to contribute those skills in a very real way during this COVID-19 crisis. Usually I'm sewing clothes like the one I'm wearing. I made this, very proud. But I wanted to contribute those skills to help our healthcare workers, and I'm sure you've heard about the fact that many of them aren't properly protected during this time. They can't do their jobs if they don't have the gear they need, and So I'm working with the Broadway Relief Project, which is a project to bring together the Broadway theater community and others to help work directly with hospitals to see what they need. And that's actually something I would recommend to you. If you want to help out, reach out to that person or group, do the research so that you're spending your time wisely, you're using the materials or the techniques that those people need. Otherwise, our skills, while we have the best intentions of the world, it's not going to be useful to them. So, this is what they wanted, and I sew about 30 of them a week. And this is the front, here you go. This is the back. It goes over the healthcare workers' clothes to protect them against this virus as they help save our loved ones. And my sister is a nurse, not here in New York City, but I think about that this is going to go to someone's sister who's going to be protecting and saving someone else's sister. And it just has really real meaning to me. And it's also wonderful as I'm staying at home, connecting with these folks who I may never meet, but there is a dialogue happening here. There is a connection through this garment, which I think is really wonderful. And anything that you may create for someone, there is that connection. One of the things that I loved about this project is that this is usually the size spool of thread that I work with on my regular sewing machine. This is the spool of thread that they gave me, quite big. And I knit, so I thought outside the box here, which is I think where all the best ideas come from, let's be honest. And this is a knitting gadget, and I realized, look at that, totally perfect. It holds it very well. And my machine here is able to sew these all together. So this has just been a really wonderful project. And whatever you may get involved in, it's going to carry with you for the rest of your lives. You're so young, and you'll just never know what path it's going to take you on. I didn't know that this is something I'd be doing 2 months ago, and it's brought all the meaning in the world to me. Our creative thinking and our teamwork and our perseverance is what's going to get us through this. So I'm going to get back to sewing these. Be well, and signing off from New York City. Bye.
Okay, I think a couple questions came up in the chat. One of them was, does it have to be antibacterial soap, or does regular soap also break down the virus?
That is a great question, because when people were going to the store and buying up everything that people couldn't get, they were buying up all the antibacterial stuff and leaving regular old soap. But that's all you need, just regular old soap. Because again, the soap itself is fat that it will pick up the virus and kind of carry it away in the water. That's what it does. So you don't have to buy anything fancy. It's just having enough water to rinse it off and enough soap to pick it up.
Why do you need to wash your hands for 20 seconds?
Yeah, so that is a great question too. The reason is, when you wash your hands, and it's not just for 20 seconds, you have to actually make sure you cover your whole hand. So what happens a lot of times when people wash their hands, they put the soap on, they go like this, and then they rinse it off, right? But the only thing that soap has touched is this part. But you can have virus on this part, you can have virus on the inside of this, you can have it in your nails, that's why you don't want to chew on your hands, right? You're gonna pick it up. So in order to wash your hands, you really want to scrub around and kind of get in there and do this and make sure. So the timing of it is to make sure that you get all of this. It's hard to wash your hands and make sure you cover all the surface areas that you need to in less than 20 seconds, right? This is what it all takes. And you want to make sure that you get it all. And it's not just rubbing, it's also kind of rinsing. You got to get it under the water so that the water can wash away the virus that got picked up on the soap. So that's a process that takes a little bit.
Does
body soap kill the virus? Yeah, I mean, it works the same as any soap. It picks it up and washes it away. It doesn't actually like kill the virus. It just grabs a hold of it and and then allows it to be flushed away.
What precautions taken for a child with asthma?
Yeah, that's a real good one too. So you want to make sure that you have your asthma medication, right? So if you have a controller medicine that you take every day, you want to be sure that you're taking it every day like you're supposed to. And if you have a rescue medicine, which is albuterol, it's the one that you take when you need to breathe and you're having trouble breathing. That's the one that you can take every couple of hours as you need to. That one you need to make sure that you have it refilled, right? That you have it and it's not expired and that there's enough medicine in there. You don't need more than that, but just make sure that it's up to date, okay? And that it's not expired. And that's then you just do your regular precautions. You know, you wear your mask, you don't go around to other people, you stay 6 feet away, you do everything else that anyone else is doing, but you do want to make sure that you're taking the medicine like your doctor told you to take it, and that you have your rescue medicine in case you need it. And then if you feel like you're having a hard time breathing or you're using your rescue medicine more than every 4 hours or so, then you really should be talking to your doctor because it sounds like you're not doing so well.
All right, everyone, we are just at time right now, so everybody give a virtual round of applause to Dr. McBrine. Thank you so much for joining us. Stay safe.
Thank you guys, you were great.
Dr. McBrine.